The moderators, the participants here present. My name is Bakunawa from Nigeria. I work for National Primary Healthcare Development Agency. So the National Primary Healthcare Development Agency is the agency that has the mandate of immunization and other PSC services in the country. And it's also a parastatus of Federal Ministry of Health. I work for the EPI, Routine Immunization Division, and I also lead the Gavi Dex and also new vaccine introduction in the country. Thank you very much. So I will be giving an update on the situation for Nigeria as far as the new vaccine introduction, just like most of the presenters, they have already mentioned most of those things. So my presentation is going to be narrowed around what are those experience we have around single dose decision. Okay. So first of all, I want to focus on some of the key areas. So this is the outline of the presentation. So looking at the introduction, the milestones of HPV introduction in the country. So factors that influence the decision in Nigeria, especially around the HPV. We have the previous recommendation as well as also the status of the country's submission, as well as some of the challenges, as well as the immediate next steps. So we'll not waste time here, but this is just to give us the general picture of our agency, which has the mandate for the immunization and PSC. So those are the goals and also some of our core responsibilities. So the first blade that was highlighted is around the some of the preventive responsibilities, which immunization is one of the key responsibility that we have in the agency. So this is the organogram of the agency. I won't waste time. So this is our structure for routine immunization division. So as you are all aware, also Nigeria, we run a program that we refer to as National Emergency Routine Immunization Coordination Center because of the numerous problems we have around immunization in the country. So we have an emergency center that is vested with the responsibility for deployment of the immunization. So we have all the partners working in immunization, they are part of it. So for decision making in the country, we have three important areas that we usually consider, and we have three major teams that play an important role in the decision for the vaccine introduction in the country. So one, we have the NBSTT, which is the Nigerian strategy team for the new vaccine. It's a task team. Then the next one, we have the NITAC, which is the recommending body for any vaccine to be introduced in the country, while we have the approval body. The approval body made up of some other structures. So we have the strategy group, we have the core group, and we have the ICC. So those are all bodies that are supposed to provide either guidance around the technical, decision, or they make the final approval, which is at the ministerial level. So those are some of those decisions. So for any decision that need to be taken around new vaccine introduction, so it has to go through those processes. So, and the same thing for one dose, this was exactly what we did. So, however, before we go to that immediately, so those are some of the milestones for the HPV, starting from before 2018. But most of the conversation that we are providing here is focused from 2018 to date, because 2018, that was the year, 2017-18, that was the year that the country made some significant changes around the immunization structure, as well as also some of the decision-making processes. So from 2018 to date, we have been making a lot of progress around immunization. And for HPV, in 2018, we developed the Nigerian Strategy for Immunization and PSC System Strengthening, NCIP. So that was a strategy document that replaced the multi-year country plan for Nigeria. And that document also initiates the process for HPV introduction in the country by providing the information around the forecast for HPV to be introduced in 2019. Then in 2019, there was a first recommendation by the NGTAC. So they made the recommendation based on the analysis of the evidence that are available. And some of those evidences are the ones that were presented by various scientists here. So they made a recommendation of Gardasil, quadrivalent, to be introduced in the country. However, immediately after 2019, in 2019, December, there was this pandemic, so which affected the global, immunization program, including in all the continents. So unfortunately, we couldn't be able to have the available, number of vaccine, because some of those vaccines were deprioritized because they are not, outbreak prone. So we have to hold on for that. So in 2020, there was flexibility. So the country wanted to introduce in 2020. So in 2020, we made the first application to Gavi. And at the same time, we now still, because of the availability of vaccine, we couldn't introduce. And in 2021, the same thing. 2022, now we are making effort to introduce because of those some important information, especially recommendation around SAGE. So what are the factors that influence the decision? So those are the 4 important things that we usually look at in the country when we are introducing vaccine. We look at the safety, efficacy, and also effectiveness of the vaccine, availability, which is very critical. Then we look at also the economic consideration, because we are still being supported by Gavi, and around the fiscal space, especially with COVID and other challenges. It was also a huge issue. Then we look at the operational component, which has to do with the delivery of the vaccines. So based on those information, the technical teams, just like I mentioned, 3 teams, technical team, we have also the guidance, then we have the approval team. So the technical team made a lot of decisions. So first of all, what we were faced with is a decision based on the SAGE recommendation. So the SAGE recommendation provided the decision that, okay, countries can use single dose. So that was a big news for the program in Nigeria. So we started reviewing the application. Just like I said, the earlier application was based on 2 doses. So we started reviewing the application, but we were met with another information that for every application that will go through Gavi, so Gavi also is interested to have the WHO position paper. So from the beginning, the information we got in the country that we cannot be able to apply using single dose because the WHO position paper was not revised. So based on that, we have to also do a lot of analysis as a country. So it was really a big challenge for us. So we have to look at what do we have in terms of the availability of vaccine, because Nigeria is a big country. We are looking at a population of about girls only. We are looking at about over 17 million girls, children in the country. So this is only girls, so excluding boys. So with that number of population, it's a big challenge for us to make progress. One, the vaccine that was recommended was Gardasil. We now consulted all the, the team and other experts. Can we have the required doses? Because if we are to introduce with 2 doses, we needed with the buffer and everything, we need more than 35 million doses of vaccine. And we realized that the overall global, expected doses in that year that we propose to introduce should be around, 45 million doses and thereabout. So Nigeria is trying to, take almost 35 million. So it's not possible. So the only option we were left with is actually to look at various strategies. So I'm not going to discuss about those strategies, but to tell you that in Nigeria, we are masters of scenarios. So we keep on modeling, developing a lot of scenarios, scenario 1, scenario 2. So this was one of the scenarios that was done based on the information from MSD that they will give us 5.8 million doses in 2023. So we said that, Nigeria, we have to introduce in 2023. What can we do is to have to target 7 states, 6 states plus FCT, and we have 36 states and FCT. So just to have emphasis. phase 1 in 2023, phase 2 in 2024, and 2025 will routinize the challenge. So that was the first scenario. Then the second scenario we had also, we realized that based on also the WHO recommendation, for public health impact, you need to also introduce using multi-age cohort. So we are also looking at best practice to have an impact on the system. So we now change the strategy. So that was the time that we say, oh, so there were competition between MSD. We also have China vaccine, Innovax came into, the discussion. So, and they promised us that we can have all the number of doses we have. So we now developed the scenario using Innovax. So we presented this one. So that scenario, we now move to another second scenario where we can have the state move into, different phases. So this scenario was also not adopted. We moved to another scenario. So this way, just to tell you that we need that, alignment in the country before we can even request for review of the recommendation. All those we were dealing with the 2-dose recommendation. So we now continue consultation. So we now got another information from Gavi after adequate consultation after the scenarios. So we now have a revised also information regarding the Gavi recommendation. So Gavi informed us that, you can actually introduce using 1 dose if you can have an internal, alignment and also approval by the regulatory body within the country. So that was what happened. So we now resolved to use a single dose, still maintaining our earlier recommendation by NITAC of 2 doses. But still with that one, we have to also go back to NITAC to have recommendation, because the earlier recommendation was using 2 doses. So we have to go for review of recommendation. So I won't waste time here because already we have those way, some of those, all those, research, papers that were presented. So those were the papers that we use in arriving at the recommendation by NITAC, including also, this is the summary of the recommendation, still it's the same papers. So this was some of the first recommendation that was given in 2019 using 2 doses. Then the second recommendation for the revise of the, we asked them to revise the recommendation. So they still, NITAC considered the revision of the recommendation. Those were the requests of the letter from the Ministry of Health through MPSCDA to revise to single dose. So those are the methodologies that were adopted by a Nigerian Strategy Advisory Group, and they came up with the recommendation for the country to use Gardasil single dose for introduction. So this gave us an opportunity to, first of all, we can introduce using 1 dose, and at the same time, we can also introduce with MAC. So we now devise our strategy after all those rigorous processes. We also consulted our regulatory body, NAFDAC. They also align with us that we can use the off-level, because that was some of the challenges. Because MSD, they are not ready also to change their level. They say they want to maintain still what they have on there, because up to now, they are still reviewing some internal review for some of those recommendations around single dose. But at least at the country level, we're able to have a alignment with the regulatory body. So what we submitted now to Gavi is a single dose recommendation in 2 phases. Phase 1, we are looking at 16 states plus the FCT. Then in phase 2, we are looking at 21 states. So, and those are some of the status of the application. In terms of the status of the application, we have submitted the application to Gavi. Then we also have all the relevant endorsement from 3 ministers, Minister of Health.
I'm sorry, Doc. I'm going to interrupt you. I'm going to ask you to conclude,
yes,
so that we can give the audience a chance to ask questions from all the presentation.
Okay.
Thank you. Sorry about that.
Okay, no problem. So thank you very much. So I think those are the last part, and also about the challenges that we faced during the recommendation. And the last one is also the immediate next step that we are looking at And most of those, the next step that we are looking at also is in line with the recommendation and some of the lessons learned from countries that have introduced. We are looking at the early commencement of engagement of all the relevant stakeholders so that we can have a robust engagement. Then we have also early commencement and development of the some of those strategies, especially the communication strategies. Then the last one also commencement of the early advocacy communication and social mobilization engagement. So our target is also to have at least 6 months social mobilization engagement so that it will give us an opportunity to really have a robust engagement within the country before the introduction in the third quarter of 2023. So thank you very much. Those are some of the processes.